Good evening and welcome. My name is Juliana Smith and I'm a student at Delaware Technical Community College. Today we will be discussing the importance of professional communication in radiography by reviewing examples of three components of professional writing in the healthcare field. For this presentation, I conducted both primary and secondary research. My primary research was done with an interview of Shelley Lynch, a Rad Tech Level 2 at the Kent General Hospital, a Bell Health hospital in Dover, Delaware. Shelley Lynch explained how the three types of professional writing in radiography are used and how they are essential for communicating with other staff members as well as patients. My secondary research was done using a library database, a DTCC library database known as EcoHost, finding research on the three different examples of professional writing in radiography and how they contribute to overall patient safety as well as satisfaction during their visit. Effective communication in healthcare is a critical component of the safe, legal, and efficient practice of dealing with both patients and staff members. Imagine a time you went to the hospital where ineffective communication with healthcare workers resulted in an unsatisfactory visit for you. Professionally communicating with patients and other clinicians involves the combination of both written and oral interactions. Today, we will be looking at medical recording, as in patient charting, accident and incident reports, as well as email. Medical recording involves charting or logging patient information into a database. The primary cause of patient dissatisfaction is a lack of effective communication. Obtaining a short medical history helps to improve patient satisfaction and maximizes examination quality. Patient histories are the reason for the patient visit, as you can see here. It is always a spot where you can log exactly what happened to the patient while they're there. Documenting the gained patient histories helps to indicate chronic conditions or injuries, which contribute to overall radiologic interpretation, which is important in diagnosis and treatment, as well as annotating images with markers and patient position. As you can see here, this is the left side. They are laying on their back, and the x-ray was done with a mobile unit. Annotating diagnostic images is essential to radiologists evaluating the images, asserting treatment to their diagnosis. Oral communication with the patient, again, involves taking their history as well as an introduction. According to Shelley Lynch, AIDIT is a practice used to gather the patient, verify the patient is who they say they are, as well as introducing yourself, explaining the examination, and thanking them for their visits. Patient consent is a huge factor. This is an example of an image order used in radiography. As you can see at the bottom, there is a pregnancy screening. All female patients are required to give their last menstrual cycle and sign off that they are not pregnant. This usually occurs with female patients between the ages of 10 and 55. The next example we will be looking at is accident and incident reports. Among the most common incidents reported are diagnostic test orders, including imaging orders. Patient safety incidences, PSIs, are the actual incidents themselves, and they attribute to quality improvement and patient safety. Reporting patient safety incidences is an essential component of quality improvement regarding patient safety. So the evaluation of these incident reports lead to discovering what incidents occurred. And this aids in the avoidance of occurrences. We can educate staff through training and policy as well as protocol changes. Shelley Lynch mentions that email, which we will look at next, is mostly regarding policy and protocol changes. Patient safety incidences, again, help with avoidance of said occurrences in the future, as well as training and said policy and protocol changes. Here is an example of an incident or accident report. The most important component of this is accuracy, explaining exactly what happened from start to finish. Shelley Lynch mentions that the date and approximate time of the occurrence must be on the report at all times. The location of the patient must be noted, where they were in the room, what room it happened in, what aspect of the hospital, as well as a body explanation, the condition of the patient before, during, and after the occurrence. And as you can see, you can exactly note any injuries that occur during the incident. The last thing we will look at is professional communication regarding email. Professional writing involves emailing coworkers. All professional emails should include a sender, a date, a subject, and effective and professional content. Two critical components of communication among healthcare workers are professional behavior and patient confidentiality. We must abide by all patient confidentiality laws as well as HIPAA when emailing about patients. According to Shelley Lynch, very rarely are emails about patients or patient condition. Most emails are regarding schedule, protocol, and policy changes. All emails should contain an appropriate greeting, effective language, who are we talking to and how do we need to talk to them, a closure statement, and of course a signature from the sender or author of the email. Be sure to mention any attachments in the email, and always thank and encourage feedback from the recipients of the email. In conclusion, professional writing in radiography is an effective form of communication necessary for practitioners to interact with themselves, other clinicians, and patients. Oral and written communication in the healthcare field are attributes of patient satisfaction, safety, and evaluation. Recording medical information on charts, appropriately documenting incident and accident reports, and exchanging professional emails in the healthcare field are all forms of professional writing that are essential to the daily practices of a diagnostic imaging department. They have an immense impact on healthcare outcomes and patient safety. Thank you so much for joining me, and have a great night.